Melanoma is a deadly skin cancer that, when diagnosed early, can essentially be curable, and when diagnosed late, there's almost nothing we can do to save a life.
Historically speaking, there have not been a lot of tools that we can use within the field of dermatology to aid us non-invasively to diagnose lesions.
For dermatologists, the greatest question is, should we be watching this, should we be biopsying this, or should we be telling the patient, don't worry?
The challenges we face every day in our offices as dermatologists are, what lesion should we biopsy?
When I first heard about MelaFind technology, I thought it was really exciting to have a tool that could help us diagnose a melanoma earlier rather than trying to remove a lot of spots or worry that we've missed something.
What makes MelaFind so powerful is the fact that it's not really technologically tough to integrate into your practice.
The problem that MelaFind helps solve for dermatologists is giving us a little earlier piece of the puzzle when it comes to skin cancer detection.
I have my clinical opinion, but then it's nice to get a second opinion from the machine also.
And it really gives us a little bit extra information, and that really is our greatest tool as a physician, is trying to piece together all these little bits of information when it comes to the patient.
With MelaFind, I can select out lesions that look suspicious to me, and then we can do the scan, which just takes a few minutes. And based on that, prioritize what we remove.
Unlike some of the other things that are out there that take 30 minutes, this takes 15 or so seconds to get the result.
The MelaFind, patients are actually leaving the office with reports and data that they otherwise would not have.
And that's why the patient acceptance is so high. Of course, they rely on our opinion, but it's very good if you sort of can approve it with a computer image.
Patients love MelaFind.
They appreciate the technology, they appreciate the time that we're taking to analyze specific lesions, and they appreciate the objective, non-invasive data that they're getting.
When they see the scan being done and they kind of see all the images that it goes through, looking through all the different layers of the skin, they find that very interesting. And they're kind of sitting there looking for that H or that L at the end to help them understand if something is of more or less concern.
It's a reinforcement. If the device shows there's load disorganization, that helps me reconfirm the fact it doesn't have to be done. And conversely, if there's a spot that I'm suspicious about and I see it has high disorganization, that also reinforces the need for the biopsy. So in both cases, it really is an adjunct to what we're doing, but patients' response has been very positive.
The impact for me personally is that it gives us more comfort in the decision whether we should take out a lesion or not. And it has a more objective view. I think every dermatologist can diagnose a difficult mole. Sometimes it's very difficult, of course, and sometimes we really worry about it and we have sleepless nights.
The idea of having an objective tool that will help me find a melanoma at its earliest stage gives me a little bit more confidence and is very fulfilling and rewarding as a dermatologist to know that I have reliable tools to help diagnose melanoma early.